Hello there guys, welcome back or welcome if you're joining us for the first time. In today's video, we'll be looking at the cholinergic system, the receptors and agonists. Now, the cholinergic system are a bunch of neurons that use acetylcholine as their neurotransmitter. For example, the nerves that make up the PSNS, your parasympathetic nervous system. For example, now cranial nerve 3 usually goes to the eye and controls meiosis. Then cranial nerve 7 really has function with the lacrimal gland and salivary gland. Lacrimal gland it promotes lacrimation, for salivary gland it promotes salivation. Then 9 also acts on the salivary gland for salivation. Then 10 does a lot of work, the vagus nerve. Heart, bradycardia, brachial split muscles, constriction, then upper GIT, increased secretion and motility. Then if you now go to the sacral parts of the craniosacral pathway of the PSNS, you have them controlling the lower GIT and the detrusor muscle of your bladder. So increase motility. Now other neurons that also produce acetylcholine include the ones in your brain for cognitive function. They use acetylcholine. Then for your sympathetic nervous system, we have sympathetic cholinergic fibers. These fibers supply the skin and help with sweating. Despite the sympathetic nervous system using norepinephrine, this one uses acetylcholine. Then for your somatic fibers, the one that supply your muscles, skeletal muscles, also use acetylcholine.